Welcome. I'm happy to be joined today by Diane Gould, the CEO of Advocates. Thank you, Diane. Appreciate you joining me today.
Glad to be here, Eric. Thanks for the invitation.
All right, so Advocates is a human service agency, which obviously the human services world has been dramatically impacted by COVID-19. What's transpired over the past few months? What does that look like?
Well, a lot has happened over the last few months. We have seen, many people become ill in terms of both our staff and people we support across the organization. We've had some losses, people we support and one staff person. So big impact on that front, people we care about, people we've known for many, many years. We also, in response to COVID-19, I think have done some great work, including, many, many systems and procedures, protocols for infection control, for taking care of people, for supporting the staff, for securing personal and protective equipment. It's been a very intense time with a lot of decisions to be made under the great pressure and strain of trying to keep people safe and well.
Yeah.
There have been other things, transforming our services, closing some programs, transitioning others to telehealth and telesupport, finding new ways of reaching out to the community and supporting the people who depend upon us. So it's been quite a mix of things in terms of all that's gone on.
How have you found the transition to like telehealth or telemedicine? I mean, has it been a challenge? I mean, I know kind of everybody had no choice, but
Yeah.
What's happened there?
It's a really interesting question because it was part of our strategic plan, to really move the organization forward into much more remote support, even for staff, like remote trainings and webinars and trying to get away from having staff travel to the main office in order to have a training, and more telehealth and telepsychiatry. But it was taking us time to get there. And then COVID-19 hit. And all of a sudden we were there.
Yeah.
And the transition has been pretty smooth. We have a very strong IT capability, and the IT team, this is true for other departments across the organization as well. In addition to programs, the IT team got very active immediately, very responsive to the need for equipment and training around how to use the telehealth platforms, and it's been very smooth. So really, all of the work of our outpatient clinics, we have 4 clinics. All of that work is being done remotely. The federal government lifted some restrictions on telephonic support for people, particularly older adults, and so that's been helpful as well. Our show rate for people for psychiatry is 100%, which has never been the case before. And there are people who really do better when they're receiving support and services in their own settings. And that's been true with day supports and with outpatient services, a little bit emergency programs. There are still services that we're doing face-to-face. In addition to our group homes, we've got a bunch of other services, emergency. We do some work in the Worcester County Jail, and also jail diversion programs. Those have continued face-to-face. But the telehealth has really been a bright note in all of this difficulty.
So I know you have the obstacles of getting to train your own staff, but did you find any big obstacles with training kind of those that were being served on the receiving end, or getting them fixed with the right equipment? I mean, were they pretty much ready to go?
It really varied, and there are still some people who are more isolated in their lives and the nature of their challenges might leave them feeling less open to remote support. Those are the people we're kind of identifying for getting to them face-to-face as quickly as we can. I would say that some some segment of the population has been a little less comfortable, like much older adults. Some of them have been less comfortable with telehealth, like video conferencing,
Sure.
Zoom conferencing, but they've been good with the telephone. So it's been helpful that there's been regulatory relief on that front.
Yeah.
We've been able to provide, the actual equipment to people who need it. There's still a segment of the community that struggles with access in relation to service. Like we can provide them with, phones or iPads, but connection to service, like internet service,
Sure.
can be challenging, and there's not a lot of financial relief for that. So I think it's worked very, very well for the bulk of the people who depend upon us for
That's
help.
fantastic, because that's a business model game changer right
I know.
there.
That's right. That's right.
Fantastic. So I know for me, and just speaking with a bunch of CEOs, that obviously this has kind of been the challenge of their career, with what's happened in crisis, what's to come. What has been kind of some of the big personal challenges that you faced, in the CEO seat?
Yeah, that's a great question. I think I've been thinking a lot about this lately, because we do feel like we're in somewhat of a different phase right now. The intensity of the beginning of this, when everybody was trying to figure out how to cope with this. Nobody had ever dealt with a pandemic before. The intensity of those early days has subsided, and the statistics are moving in the right direction. Fewer people are sick and more people are recovering. And so there is the experience, and we have enough personal and protective equipment today. So there's an experience of a little bit of room to breathe and think about what this has been like. So I would say that one of the challenges really has just been staying calm in the face of quite an emergency. And along with that, holding our community, the advocates community, together in the face of profound loss and deep worry.
High stress levels.
Yeah. And so, of course, those things affect me and affect us personally, as well as everyone we're trying to take care of. So I think holding all of that, finding the room and the space to hold all of that, the weight of, responsibility associated with protecting people, taking care of people's health and safety while managing financially, while advocating for additional resources. And those things are always in play as a CEO, but never like this, never before like this. And go ahead.
How have you seen the shift in resources kind of impact things? Like where has that landed today?
Yeah, so in this fiscal year 20, the government, from our perspective, has been very, very responsive. And it's fiscal year 21, that's a problem. So right through June 30th, we've received supplemental payments from state government, state agencies, DDS and DMH. We just got a substantial supplemental payment from Mass Health this week. We got a little more financial support for COVID-related expenses from DDS this week at the local level. And so we got a little money from the federal government, and the foundations have been incredibly generous with emergency relief funding. And individual donors, I really wondered whether individual and family donations would fall off, and they've increased. People, I think, are feeling very grateful to us and to other providers for what we do and how we're taking care of the people who are important to them. And they have continued making donations. So we've had a lot of financial support on the philanthropy side, on the charitable side, and state government has been very, as I said, very responsive. So we came into the crisis in pretty good shape financially, and we're ending the fiscal year okay. We're going to do a little bit of break even. All of that ends, with the exception of 1 month of Mass Health support, all of that ends on the 1st of July.
Which is the start of your fiscal year.
That's right. So next fiscal year feels very worrisome, a lot of uncertainty. Will there be additional supplemental funding? We don't know. Will the regulatory relief that has been provided, will that change? Will the federal government provide emergency relief to states? What is the governor here going to do with a $6 billion deficit in the state budget? How long will the coronavirus continue? For how many more weeks and months will we have to pay our staff, rightly so, pay our staff more to do the hard work of taking care of people who are sick? You know, all of those are variables in terms of the FY21 budget. And so we're, you know, doing the best we can with making some assumptions for 21, but we really don't know how it's going to go. So,
Yeah, that is, I mean, it's so complex and there's so
yeah.
many factors. It's wild. But I mean, even though there's uncertainty in the financial, you know, outlook for 2021 and, you know, in that fiscal year coming up and maybe even the years beyond,
Yeah.
you know, how are you seeing this crisis, you know, drive opportunity or, you know, because, you know, the organizations I've spoken with so far, you know, the CEOs are just kind of starting to come out of crisis management where, you know, the stress levels that were through the roof because, you know, fear of the unknown and like how big is this thing and things of that nature, and dealing with those stress levels was just exponential. It's even hard to put into words, right? But as you start to really come out of that fog and see the road ahead, like what are the opportunities? What are the things that you know, folks should be paying attention to?
Yeah. Well, I think the first thing that comes to mind is the ways in which services need to be redesigned, including some of the transformations that we've made already and keeping those in place. And that involves like sticking with it. And it also involves advocacy with payers so that we are able to continue to, so that these models are sustainable financially. But I think the opportunities, I was talking about this, we have a twice weekly community conversation at Advocates open to the whole, you know, everyone we support, everyone we employ by Zoom to just talk about, you know, updates and for me to answer questions. And we were talking about how some of the changes have been much better for people we support than how we were doing things before. And so this principle that we all have of accessible services delivered in the ways that people really need and really want them to be delivered, we're doing that now in a way that we haven't done it in quite the same way before. And so there's, I think, tremendous opportunity to maintain that going forward. And these models, which are in many cases preferable for individuals and families, are also more efficient and more cost effective. And that's true in day services, it's true in outpatient, it may be true a bit in emergency services. So that's one opportunity. I think the other is in our region and in our, I would say even in our state, provider relations are strong. And that was in evidence through this pandemic, that CEOs, we have leaned on each other for consultation and support, for practical support, for emotional support, for PPE sources. There are a bunch of ways that we have come together as a community because we're facing the same awful situation. And I think out of that will come potentially increased opportunities for partnership and collaboration, including affiliation. I think there may be some organizations that struggle, perhaps some of the smaller organizations, certainly organizations that have provided day services only, may be in need of more partnership than they've had the need for in the past. So I think system transformation and partnership and collaboration are the two things that come to mind in terms of opportunities.
So when you look at that systems transformation, like any specific examples like come to mind with, you know, how maybe you thought that a service that you were delivering had a particular value, but then you delivered it a different way, the new way because of COVID, right? And people responded more favorably or more positively than you thought they were going to, you know, anything, you know, what type of services come to mind? Maybe give an example.
Yeah, I can think of a couple of things. One, And these are kind of examples of individual care.
Sure.
Somebody who receives services from our Life Skills and Learning Center, which is our rehabilitation program, who struggled to benefit from on-site services at the day hab. He's been fully engaged at home, receiving services remotely, and really benefiting from those services. And I think at that level, that's a change that's really welcome and that I would want to see continue. Another example is we have a very large and robust peer support team, people with lived experience in recovery from behavioral health conditions. They're doing online virtual support groups for the first time. They've done community-based support groups, but they're getting, they're reaching people across the country who are seeing that these support groups are available online and attending them. And so I think the possibility of reaching more people is there in a way that it's never been before.
That's wonderful.
One last thing, if I could, Eric, and that is the possibility of engaging large and diverse teams of people, large groups of stakeholders that would be next to impossible to get in the same room together for the purposes of planning an initiative or planning a care plan is just easy to do today.
Yeah.
In a way that was kind of impossible to do before this.
Yeah, you bring up an interesting point because there's one factor that I deal with probably more in associations when I'm consulting with associations, 501c6s, is this because one of their core services is education to the industry that they serve. Yeah. And the challenge they're dealing with is this concept of elimination of geographical borders and boundaries. Mm-hmm. And it didn't dawn on me until what you had just said about providing virtual services in human services, that folks need to really understand that there's no geographical restrictions to that. Mm-hmm. And that you can look at providing services, especially if you deliver really great services to people elsewhere. And I'm sure there's funding things that relate to that, but as far as value proposition, that's pretty powerful.
It is powerful, and it will have interesting implications in terms of historical
relationships and competition. Yeah, that's the effect it's having on the association side.
Right, because we've had a respect for geographical boundaries. We've had a respect for the fact that in many cases, community-based providers have been in their communities and of their communities. They know the communities really well. They're embedded. And what does it mean in this new world of more virtual services? So from a relationship perspective, and what is the community today? And the other thing that comes to mind in relation to that is thoughtfulness about what kinds of services need to be delivered in ways that are more traditional.
Yeah.
What circumstances, what conditions, for whom is face-to-face, like sitting in the same room together, really the best way to deliver a service. And so I think this time gives us tremendous opportunity to create options for people so that we're not all one way or all another, but there are a much broader range of options for people.
Yeah, that's fantastic. And you mentioned something there, and I think that you in our work together, you've done an amazing job of being incredibly intentional about defining who your organization is, the value and the cultures. And probably more so than many that I've worked with. How do you think that is going to play out as being important either in service delivery or to the other thing that you had mentioned, partnerships and looking at collaborations as the world gets smaller because of technology? Really, so does the consolidation happens because of that, because we find that certain providers do things a certain way, and we want to be a part of that journey.
Right.
So how do you keep with tech things moving virtual and maybe partnerships expanding or opportunities for partnerships, how do you really focus on that culture piece or maintain that?
It's such a great question, Eric. I think about it a lot. And these days we're doing a little bit of planning for creating a plan to plan for the future that includes who are we going to be as an organization going forward? Who will our partners be? What kinds of services will we be delivering, and how will we keep our core values in place in the face of this tremendous change? And so I think there are a few things that are important here. One is that I know we're not alone in this, that we have articulated those values, and we start every meeting by talking, by reading from that set of values. We have an incredible group of people I referenced earlier, the peer team, people with lived experience who kind of keep me on the right path going forward, so that we keep balancing. And we have, I think the other opportunity here, which has really surprised me, is that in terms of both staff and people we support, and families, there's a stronger connection today than I ever would have thought possible in the face of all of this disruption. That this ability for you and I to talk like this, as opposed to trying to schedule a meeting and get to each other, has really strengthened the connection. There are staff who say they've never felt as connected to senior leadership before as they do today. And so I think continuing to draw on the wisdom of families and people we support and our staff to help us stay steady on the values front while we pursue, new business opportunities. It's something about that. So.
That's great. I think that becomes even more relevant as technology affords us the ability to provide more and more customer service or person-centered care, person-centered planning. Having those direct lines of communication already established to really, expand on that or assess that dialogue, just allows you to understand the services that, an individual may need. Because we're seeing a lot of that, technology is affording that customization.
Right.
So
it has surprised me some, I have to say,
me
as
too.
somebody. Yeah. It's been very, very interesting and eye-opening.
Yeah, I definitely feel the bonds have strengthened, either whether that's out of a shared crisis of suffering through this whole thing, because nothing builds bonds better than suffering, or just the need to communicate with so many different people has seemed to open up just a lot of really wonderful doors, either getting to know new people or deepening relationships with kind of your existing network.
I think it's really, really important that we each and that we all take an opportunity soon to really pause and say, what have we learned from this? And what do we want to preserve? And not just in an individual organization, but together with our partners, with our colleagues, and with our payers and our government, to say, what did we learn from this? And what can we preserve going forward? And how can we make sure that we preserve those things going forward? Because I feel it as the governor's plan gets underway, as we do our own, adaptation plan for the future, trying to get back to some in-office operations, some in-person support, that we run the risk of kind of sliding back into old ways or losing some of the great benefits that came with this crisis. So I think that'll be really, really important.
So in addition to that, is there any type of advice that you would give other CEOs out there? Because I know advocates, being as large as they are as a human service agency, you guys kind of have a big spectrum of services and things of that nature. There's a lot of organizations out there that run the gambit between, small, medium, large, and I'll even call it jumbo. What thoughts, advice, wisdom, ideas do you want to kind of spread to some other leaders that might be in the nonprofit community?
This will not be news to my colleagues, to, our colleagues. The word that comes to mind is connect. That's, I think, the best advice these days is make connections, cultivate connections, keep those connections, be open to new ideas. And yeah, I think and that good things will flow from that.
Mhm.
Opportunities, resources, um, the great benefit of just living and working in connection with other people. So I think, eh, you know, so that's what comes to mind for
Well,
us.
that's fantastic. That's fantastic. I always like to end our discussions on a high note. And are there any kind of bright spots or
Mhm.
bright spot stories that stand out in your mind that have happened over the past couple months that are worth
Yeah.
note?
A couple of things. One is we had this was an idea that came from our advancement team to do these car parades to thank the people who were, in many cases, living in at the group homes and at the very least working many shifts in a row at the group homes, and the people who were kind of locked down living there. So we had a bunch of people from our administrative operations teams um, get into these car parades and drive by the group homes with signs and honking horns and getting out and waving. And it was tremendously uplifting for people like who were in the homes
Oh
and
yeah.
people doing the car parades. They were really fun and really uplifting. And I think an aspect of that has been the way that all parts of the organization have come closer together so that we have staff in our administrative teams who are doing grocery shopping for programs, who are delivering supplies, who are making phone calls weekly to the managers to just check in. How are you doing? Do you need anything? How can I be helpful? Um, and so those have been really bright spots. Our chief medical officer said to me this morning, the opportunity to work across the organization with individuals he might not have worked with, given his role and title under ordinary circumstances. So a lot of it's been about relationship, about connection, about being in it together. That's been wonderful. It's been kind of inspirational and it's been sustaining through an unimaginably difficult time.
Yeah, we've done a few of the car parade birthdays for
Have
my
you?
10-year-old, and either him receiving it because it was his birthday not too long ago, or him going to his friends. I mean, you can just see how excited they are to see their friends, and it's spiritually uplifting,
Yeah, yeah, that's a good way to put it. Yeah.
which is really nice. I'm glad you guys are doing that. Um, I want to thank you for a really awesome discussion. It's really been great to have the opportunity to talk to you. So thank you very much.
Yeah, I really appreciate it. Eric, it was fun to do. So thank you very much.
So if anyone would like to find out more about advocates, please click the link below. And please subscribe and check out more discussions with great leaders like Diane.